Warm morning light, a mug in my hands, and my knees saying, we might need a gentle negotiation today. I wanted to try just one thing to see if it changed how I felt in the hour after I woke. That one thing is what we're talking about today. Simple kitchen-first rituals, a small topical, and a 5-minute mobility flow. Let's try this together.
The promise for listeners: practical, low-risk steps you can try this week, plus a clear 14-day micro-trial so you can measure whether something actually helps. We'll also be careful about who should pause and check in with a clinician. From a scientific perspective, we'll name what's evidence-based and what's traditionally helpful.
Quick note on accessibility. Every audio movement cue we do will have a written alternative in the show notes and a slower-paced option if you prefer. Fiona, quick hello?
Hello. Hi, everyone. We're excited to welcome 3 guests who make this practical. Dr. Meera Patel, a rheumatologist, Lena Ortega, a clinical herbalist, and Marco Ruiz, a physical therapist. Each one will bring a different piece so you can test one small change safely.
Thank you. Happy to be here. I'll focus on red flags and exactly when to seek care. Joint stiffness is common, but sometimes stiffness with fever, rapid swelling, intense warmth, or severe loss of function means urgent evaluation is needed. I'll read a short referral script later you can use verbatim with a clinician or pharmacist. Hello, I'm delighted. I'll translate broth traditions into a single-serve restorative bowl you can make in minutes, focusing on protein and vitamin C to support tissue repair, plus warming spices that feel comforting. Great to be here. I'll lead a 5-minute morning mobility routine that's audio first, so you can do it in bed or next to your mat. And I'll give slower alternatives and strict stop cues for anyone with unstable joints or recent injury.
Before we dive, Fiona, can you briefly say what's actually happening in a stiff morning? Like, why do joints feel slow?
Sure. Mechanically, overnight immobility lets joint fluids settle and soft tissues tighten. Metabolically, low-level inflammation, sometimes from wear and tear or systemic sources, can increase stiffness. Small habit changes like gentle movement, warming topicals, and nutrient-dense meals can reduce symptoms for many people, but they're not treatments for inflammatory arthritis or infection.
Exactly. For listeners, that means realistic expectations. These rituals can ease symptoms and improve function for mild, non-inflammatory stiffness. But if you notice fever, rapidly worsening swelling, intense redness or warmth, or a big drop in function, please seek urgent care. Here's a simple referral phrase you can use. I've had increasing joint stiffness with redness and swelling over 48 hours. Can you evaluate me for inflammatory or infectious causes?
That script is gold. Keep it handy. Okay, prep checklist. Lena, what should listeners have ready for the demos?
For the broth bowl, a small pot, 1 cup of water, 1 cup of shredded cooked chicken or neutral firm fish, optional for protein, 1 tablespoon of apple cider vinegar or lemon juice for collagen extraction, half a teaspoon turmeric, a thumb-sized piece of ginger, a squeeze of citrus, and a pinch of sea salt. For the rub, a small jar, neutral oil like grapeseed or fractionated coconut, ground ginger and cinnamon, and a little cayenne only if your skin tolerates heat. For movement, a mat or firm chair and comfortable clothes.
Demo A, Restorative Broth Bowl. I'm going to read the ingredient list slowly so anyone cooking along can jot it down. We also have the full written recipe in the show notes. Ingredients: single serve, 1 cup of water, 3 ounces shredded cooked chicken, about the palm of your hand, or 1/2 cup cooked white beans for a vegetarian option, 1 tablespoon apple cider vinegar or lemon juice, 1-inch piece fresh ginger, grated, 1/4 teaspoon turmeric, 1 teaspoon finely chopped parsley or a squeeze of orange for vitamin C, 1/2 teaspoon miso or a pinch of salt to taste. Optional, 1 teaspoon collagen peptide if you use it.
Quick nutrient notes while you gather those. The vinegar or lemon helps extract collagen precursors from bones if you're using bone broth. Protein provides amino acids for tissue repair. Vitamin C supports collagen synthesis and acts as an antioxidant. Turmeric has small anti-inflammatory effects at dietary amounts when combined with black pepper for bioavailability, though we'll keep amounts modest here.
Step by step. Step 1. Pour 1 cup of water into your small pot and bring to a gentle simmer. Step 2. Add your shredded protein or beans, your tablespoon of vinegar or lemon, and the grated ginger. Step 3. Stir in 1/4 teaspoon turmeric and a pinch of black pepper. Reduce heat and simmer gently for 5 minutes. Step 4. Remove from heat. Add your parsley or orange squeeze, a teaspoon of miso or salt, and taste. That's it. Cozy, warming, and restorative.
Variant tips. If you only have powdered ginger, use 1/4 teaspoon. If you want richness, add a splash of olive oil or a teaspoon of tahini. Make it your own, one small step. This can be morning or mid-afternoon, and we recommend starting with 1 bowl a day for the 14-day micro trial.
Storage note: make a single serving each morning for freshness, or keep a prepped portion in the fridge up to 48 hours and warm gently. If you're tracking outcomes, we suggest drinking it within 30-60 minutes of waking for the clearest comparison during the micro trial.
Demo B, Warming Spice and Oil Rub. This is conservative dilution math. Please do the on-air patch test with us if you plan to try it. Lena, walk us through the formula.
We'll make a single-use batch. Base oil, 1 tablespoon neutral oil. Add 1/8 teaspoon ground ginger, 1/8 teaspoon ground cinnamon, and a tiny pinch of cayenne if you tolerate heat. That's about 1/16 teaspoon. Mix well in a small jar. This is a gentler concentration designed to feel warming without strong irritation.
Safety note: do not use this if you're on anticoagulants, have recent surgery, open wounds, or are pregnant without checking with a clinician. Topical agents can interact with medications or cause bleeding risk if concentrated incorrectly.
Okay, patch test step by step and do this on a clean forearm. Step 1, apply a dime-sized drop to the inside of your elbow. Step 2, leave it uncovered and wait 15 minutes. Step 3, if there's no intense redness, blistering, severe burning, or spreading rash, it's likely tolerable for small area use. If you feel a strong burning or see a marked reaction, wash it off and don't use it on broken skin.
Frequency guidance. Use the rub once daily at most. Apply gently for 1 to 2 minutes and wiped away after 20 to 30 minutes if you like. Single-use batch sizes help avoid oxidation and contamination. If you notice persistent irritation, stop and check in with a clinician.
Demo C, 5-minute morning mobility sequence. Marco, lead us, and give a slower variant after each cue for people who want to move more gently.
All right, find something stable, a bed edge, chair, or mat. I'll name each step, then offer a slow alternative. We'll use a steady breath. Inhale through the nose, exhale through the mouth. Step 1, ankle pumps, 30 seconds. Point your toes, flex back toward the shin. Slow option, 15 pumps with a break. Step 2, seated hip marches, 40 seconds. Lift one knee a comfortable height, alternate. Slow option, lift and hold 1 to 2 seconds each side. Step 3, seated cat-cow, 40 seconds. Round your spine on an exhale, lengthen on an inhale. Slow option, just gentle tilts. Step 4, sit to stand mini reps, 30 seconds. Use your hands if needed. Slow option, do half reps or stand with assistance. Step 5, standing weight shifts and gentle knee bends, 40 seconds. Micro bend the knees, shift weight side to side. Slow option, hold onto a chair and do tiny shifts. Finish with a deep breath and notice how your joints feel.
Marco, quick safety cues while listeners are following. Common stop signs and when to back off.
Yes, stop if you feel sharp pain, instability, or any new numbness or tingling. If movements increase significant swelling or cause you to fall off a normal baseline, stop and consult a clinician. For unstable knees or recent joint replacement, choose the seated alternatives and check with your PT first.
Now, how to run the 14-day micro trial. We recommend a single change. Pick one demo, broth, topical after patch test, or mobility, and stick with that as your only new action for 14 days. Daily metrics: 0 to 10 morning stiffness score immediately on laking. 30-second sit-to-stand count, once per day. Stair ease, 0 to 10, after climbing a flight or a few steps. And a brief sleep score each morning. Record them in the Principal Tracker.
Stop rules if stiffness or pain worsens noticeably, if new swelling appears, or if any red flag signs Dr. Mira mentioned show up. Pause the trial and contact your clinician. This microtrial is observational, low expectation, and designed to give you useful data to share with your provider.
A quick clinical note on expectations. Modest improvements in morning stiffness and function are realistic for many people within 2 weeks, especially with mobility and dietary consistency. But absence of change doesn't mean failure. It's useful information. If after 14 days you see no improvement or any markers worsen, bring your tracker to your clinician. Use this direct phrase: I tried a 2-week mobility/diet trial and monitored my morning stiffness and function. My symptoms didn't improve. Can we review next steps? A gentle reminder about interactions. If you choose topical or herbal elements and you're on blood thinners, pregnant, breastfeeding, or have recently had surgery, check with your clinician or pharmacist first. We also provide safer alternatives in the show notes, and you can choose the broth or mobility option instead.
Before we close, Dr. Mira, could you read the red flag script for listeners to keep handy? Say it slowly so people can repeat it.
I have increasing joint stiffness with swelling and redness that started or worsened over 24-48 hours. I am concerned about an inflammatory or infectious cause and would like an evaluation. This is urgent. I have fever and rapidly worsening joint swelling and pain.
Those are precise and simple. We've also included a short clinician-facing summary in the show notes if you want to print it and bring it to an appointment.
Reflection and encouragement. Small, consistent steps are how we learn about our bodies. Start small. Try one of these demos this week. Record your daily numbers and notice patterns. It's not about perfection. It's about honest observation and sharing that data.
If you do the mobility every morning, keep the pace gentle and focus on breath. Even 5 minutes of consistent, mindful movement often shifts how joints feel during the day. And if you make the broth, notice the warmth, the aroma, and how a single bowl can become a ritual. Taste slowly. Small sensory rituals support adherence and enjoyment.
Last practical notes. We've added written movement cues and slower variants in the show notes, a printable patch test guide, dilution math for the rub, and the full 14-day tracker. Use those resources. They're designed to remove guesswork.
CTA, try one demo this week and share what you noticed. Tag @EarthyRemedy with a photo or a 15 to 60-second voice note, or post to the hashtag #WhatITriedThisWeek. We'll read selected shares on next episode and highlight successes and useful tweaks.
Also, download the tracker and patch test guide in the show notes. If something feels off or results are surprising, bring your notes to a clinician and use those referral phrases Dr. Mira shared.
Take care, and remember, if you have any of the red flag signs, fever, rapidly worsening swelling, intense warmth, or severe functional loss, seek urgent evaluation. These rituals are supportive, not replacements for timely medical care.
Thank you to our guests, Lena, Marco, Dr. Mira, and to you, listener. Slow and steady. One small step. Listen to your body. Trust the earth. Feel the difference.
Subscribe so you don't miss the printable resources and our next micro trial. We'll be back with more practical, evidence-aware rituals.